Dr. Sportelli, you're also an addiction expert. This is part of your practice, helping people dealing with addiction problems. What is your opinion of what Dr. Ripas says, the importance of NAD as a tool in the treating addiction?
Yeah, listen, I'm going to tell you right off the bat, I hope that this works. I hope that it works as well as Dr. Ripas says. I think that alcohol dependence is very, very different physiologically than opioid dependence. Opioid dependence is very, very different neurologically and physiologically than methamphetamine dependence. There are different things happening in the brain, different receptors, dopamine versus GABA versus glutamate. All these things are very, very specific. So sometimes when I hear that there's one wonder that can just solve all of these problems in addiction, it makes me a little bit skeptical. But I will say this, that if it's promising, I'm open to it and I'm all for it. And I'm actually really eager to continue with this discussion. Dr. Basha, I want to bring you into this. Why do you think that NAD should not be a mainstay in addiction medicine?
The issue is not so much that NAD itself will cause some problems. The issue is that we have very good alternatives, in particular for opioid addiction. And in a time where we have rising, skyrocketing overdose death rates in the nation, they continue to increase. I think the emphasis in public policy and among physicians and other healthcare practitioners is getting people into the treatments that we know work. So the analogy I would give, for example, is if you had a crisis of cancer, and instead of telling people, let's go use the proven treatments, whether that be chemotherapy or radiation, let's try something experimental. Let's give you vitamins, just as an example. That's really problematic. Not that vitamin C, for example, would somehow harm them, but rather that they are not getting the life-saving treatment that they might otherwise get. One of the issues with NAD is that it requires, to my knowledge, detoxification. And actually, in order to get on methadone and buprenorphine, you don't need to totally detoxify. So the concern to me, again, is you're pushing people towards an alternative when we have treatments that are very effective. If anything, we need to be getting more people into what already works.
All right, back to you, Dr. Ripas. What's your response?
I can appreciate where she's coming from, but unfortunately, she's not looking at the entire picture. NAD helps to restore people back to their full self, back to their normal homeostasis. With fentanyl, you can't just switch somebody to Suboxone so easily. It's very difficult. It takes a week and it's miserable, and they're detoxing anyway to get to Suboxone. Fentanyl is a totally different animal. We need to remove substances from a person's body and help them recover. And even after they've been on Suboxone for a while and stabilized, they may not be very happy. They may not feel their full selves. I detox people from Suboxone frequently for this very reason. They may be on Suboxone for 10 years. It may have saved their life. Don't get me wrong. I agree with that. I respect that. But when it comes to wanting to get off of that, to wanting to have their fullest life, they want to have that option available to them, and they deserve to. One of the key things that I learned when I learned about how to use NAD is that it really prevents delirium. You know, I watch people go into the ICU and be intubated, from delirium, from withdrawal from alcohol. This prevents it. This is life-saving.
Dr. Ripas, thank you. And I do agree with you, and I treat people in the ICUs, and we do have to put people on a ventilator and put them on Ativan drips, for example, and Librium and all that stuff, because when people are going through alcohol withdrawal, it's incredibly dangerous. And as you know, once someone's in DTs, if it's untreated, there's a 30% mortality rate, which is very frightening. I don't think people realize that. Yeah. Unfortunately, when I did my research, I looked up some meta-analyses and some articles. I only found like 2 that had any significant power as a good study, which is unfortunate, because I think there should certainly be more studies to help facilitate more use, as you're saying, if it's this powerful.